All right, so I was telling the young ladies today, adult health 2 is all about critical care. And I'm not saying that sometimes I really think adult health 1 is harder because that's where you're laying the foundation. And this is things that you may or may not have ever heard of before. But I'm not talking about diabetes, not diabetes, the normal diabetes, diabetes type 1 and type 2, except for this. So, it involves insulin, right? In some way, shape, form, or fashion. So, you need insulin to get glucose in the cells. Diabetes type 1, you have none. Diabetes type 2 is because of you. Sedentary lifestyle, poor diet. That's all we're saying about that. A lot of times in adult health 2, the stuff we're talking about is the unicorns, not the zebras. Does that make sense? Guys, this is some stuff you may never see. If you're in trauma, ICU, you may have already, or you may, before you get out of this semester, see diabetes insipidus. Frequently, the last thing that you hear before they develop this is, hey y'all, watch this, hold my beer. Traumatic brain injury, it disrupts the posterior pituitary from the trauma, secretes all the ADH, and it results from diving off the second story, trying to hit the pool and miscalculating the length. And hit your head first. Yes, a lot of Jack, Jim, and Jose evidently was involved. But, and I know you said you hate endocrine. Can you live without your endocrine system? You can. This is the way I need you to learn endocrine. Don't get caught up in it. We ain't going to the, is the master gland important? What is it? The pituitary. All right, that's all we're saying about that. I want you to know the name of this gland for this disorder. What hormone does it secrete? What effect does it have on the body? And there's a few absolutely, guys, when I'm telling you this is a life-threatening emergent conditions and there's only 2 or 3, it's kind of like a tension pneumo. A thyroid storm will kill you if it has started. It's real hard to stop. What does the endocrine system do? Stop reading that. I saw that. It does regulate your body systems. And how does it work? By using hormones. What does it regulate? Temperature? Everything? Pretty much. So you said temperature. It is homeostasis. If your temperature's up, if you're running the marathon, what else is up? Heart rate. If all of that is up, is your metabolism up? Y'all ever seen somebody who can eat the chocolate cakes and the cookies and all that and never gain a pound? We hate them. Growth and development. What about adapting to change? What are we talking about? Fight or flight? Stress? So, I'm going to say this, and y'all going to be like, stress and organs. gonna graduate, about a week later, everybody in here is gonna be sick. Why? Because your stress level and your cortisol level is gone. And you're gonna crash. And I've had every semester, when y'all graduate, somebody's gonna call me, I'm so sick. I told you. And the thing is, after everybody graduates, about a week after graduation, I'm sick too. But it's okay. A stress response is a stress response. Y'all have been under this stress response for how long? For however long this program has been for you. And it has been a continued stress response. Does your body do anything well for that long? It can't keep that up. So it secretes the hormones. Does it just float around and it don't know where to go? It's got something that it targets, right? And then it produces its effect on the body. How does it work? What is a negative feedback loop? Huh? You wait for something to happen and then it corrects it. Like what?
Like increase the heart rate until the CO2 acid is balanced and the heart rate goes back down.
Okay. What else? So, if you have hypothermia, why do we shiver? What are those little, you're shivering to warm up? Well, if your body temperature goes up, you're going to stop what? Eventually, you're going to start shivering. Anybody in here, your blood sugar, you might not be a diabetic, but your blood sugar drop, you get the what? The shakes. Your body's trying to tell you to eat, so your blood sugar's dropping. If you eat something, you're going to stop shaking. All that has cut off. So negative feedback is your thermostat. It is the ninth layer of hell hot right now. You walk in your house and you done set it to 72. Well, it is literally 105 degrees outside. You walk in your house and you're dying, so you set it to 70. Once it kicks on and it gets to 70, what's going to happen? It's going to stop. There is one gland and one organ system that is a positive feedback. Does anybody know what it is? And somebody in here wanted to go into that specialty.
Contractions.
It is, and it's the uterus. When does it stop? When the baby's out. Because that would make a whole lot of sense. Contraction. Oh, I'm going to stop. The contractions will build and get stronger and stronger and stronger until it's gone. And then it's not going to create any more of a hormone. You either got too much or not enough. That is not hard. So we're going to talk about the thyroid gland. You've got hypothyroidism. Guys, there is a study guide for this that is downloaded. You got diabetes insipidus. Which hormone is that? It's ADH. What does that stand for? Anti-diuretic. If you diurese something, what happens? You pee. Pee. What are you going to do? Hold on to it. What they going to look like? The Michelin Man. Your parathyroid gland is either too little or too much. Addison's and Cushing's, That's your cortisol. Your adrenal glands secrete 3 different things. We're only going to talk about 2 of the hormones. What?
Slide 5. It's in the notes section. Slide 5 was just.
I just couldn't figure out.
It's the same. It was just flipped on ours.
Well, like the,
And we had
the
a
info is
global
the same, but
box.
the content is different a little bit.
Well, no, I don't want you guys to have it all content.
Or like the presentation. This is like the formatting is different, but the information is the same.
That's right.
As long as the info was there.
So I had to break it into 2 parts before. This just broke it into too much or not enough. So you either got hyperthyroidism, syndrome of inappropriate ADH, which is also shortened to SIADH, hyperparathyroidism, Cushing's, I had trouble with this word, pheochromocytoma, not enough, hypo anything is too low. Hypothyroidism, diabetes insipidus is not enough, ADH, hypoparathyroidism, Addison's, and adrenal insufficiency. Guys, I've made this kind of easy for you. There's a gland, there's a hormone, that's the effect. There's what we talked about, cortisol, aldosterone, and your adrenal glands get your adrenaline up. Your parathyroid gland is all about what? Calcium. This is kind of a memory trick. But if you remember that it's anti-diuretic, then it makes sense. What is your thyroid gland? What hormone? T3 and T4. If you were in the emergency room and somebody comes in that's tachycardic as hell, what labs do they always order if they don't know why? T3 and T4, they'll do a thyroid panel. Why are they doing that? Because it might be a cause. If they don't know why if they come in and say, oh my God, I've got cardiac problems and I've been going in SVT and it's usually at 220, I take all these meds, I've had cardiac ablation, they're still gonna do a thyroid panel, but they might not do it as fast. They might be trying to work a cardiac angle. If they don't know the reason, they're gonna do these quick to see if that's the reason. Your parathyroid gland has everything to do with calcium. What does your thyroid gland regulate? Say it louder. Metabolism. Because does anybody know anybody's family and oh my God, they can't get out of bed, can't get out of the couch, gaining weight, can't understand it. And so they gonna go to the doctor, what are they gonna test them for? Hypothyroidism. The same thing. If they losing all this weight and ain't trying and eating the house, heat intolerant is not even the word. Like, want to get naked and walk outside, even though right now that's the thing. Irritable. Why would they be irritable? If your metabolism is plus 10, it's like you got ADHD plus 10 and you ain't got no meds. If this is your metabolism and it's high, is everything high? Too much T3 and T4. High and hot. If your metabolism is ramped up, what do we say your temperature is going to be? You're going to be hot. What is Graves' disease? It is bulging eyes. What kind of disease is it? Do you know?
Endocrine.
Hit him. There you go. It is an autoimmune. We don't really know why they have it. A lot of times, how do they find it out? You just said it. They start seeing what? A lot of times their eyes begin to bulge, and who do you think might be the first person that notices it? Their optician. Oh dear God, optometrist. I need a nap. Yeah, their OB doctor is going to see it. So high symptoms, besides their temperature, what else is high? Heart rate, heat intolerant, irritability. So as far as another cause, what is a nodule? They might. Have y'all ever had a? You go in for a physical. Are you alright with this? So the doctor, nurse practitioner, PA gets behind you, and they don't press a little bit. Like I'm having trouble swallowing when they do this, and they're holding right here, and they're like swallow, and you're like, I can't swallow. What are they feeling for? They're feeling. Sometimes. They're feeling right here. Where's your thyroid gland? Right here. If you have a practiced practitioner, they can feel those nodules. I had a good friend that she was at a college. And it was the school physical. And she's like, that nurse practitioner kept me in there forever and kept me doing that and doing it. And I was like, what did you say? She sent me for a referral. I was like, oh God. She was getting a partial thyroidectomy. Now, do you think the nodules are benign? But what? They can be precancerous. So, they might take it out. What's thyroiditis? What does iodine have to do with this? Why is iodine important for your thyroid gland? And T3 and T4?
Goiter.
Huh?
It's goiter if you have too little or too much.
Both. It can cause a goiter if you don't have enough or if you have too much. If y'all don't know, look it up. Why do you have to have iodine? There you go. To make T3 and T4, you have to have iodine. How did the United States solve that problem? In like the 40s or 50s. What did we put it in? Salt. Do we have that problem? No, we went overboard. Everybody salts everything. Where does this happen now? Not in the United States. They haven't put iodine in the salt. They're not getting iodine. So then what develops? The goiter. Guys, if the goiter's here, what can that affect? Airway. So here's your thyroid. Where's your cryo membrane?
Somewhere around there.
So I ain't picking on the males, but y'all is easier to find. Garrett, you right with this? Let me get that. His is right there. That's where you put a surgical airway. Where's the goiter? Right here. So if it swells big enough, guess what you ain't gonna do? To save him. So, too much iodine can also create a goiter. High heart is, I told you, high and hot. High heart rate, high blood pressure, heart palpitations. Hot and sweaty, heat intolerance, fast metabolism. What's fast metabolism for your gut? It ain't constipation, it ain't slow, it's diarrhea. Everything is fast. What are we going to do about it? You ain't going to push them in the room and not look at them. If they're having palpitations and high blood pressure, you're going to put them on the monitor. They might have to do surgery. What is that radioactive iodine therapy? It can kill it. Now, do you need your thyroid gland? You do. If I destroy it, what are you going to have to be on? Forever. What's the name of it? Synthroid. I looked it up a long time ago, but I do not remember the evidence. This is the only medication I have ever heard of them say, I want you to get the name brand. And I looked it up and I don't remember. This med you need to take the same time every day. They may have to go in and take out the nodule. Yes, ma'am.
Didn't they move away from like killing the thyroid essentially? At least.
Why would I want to just take out a little bit? You'll still make some of the hormones. Guys, that's better if you make your own hormones. I don't want to put you on meds for the rest of your... It is hard because you have to titrate. You have to go get blood drawn. And at first, it's kind of like when you're on ADHD, you got to come back every 2 weeks. Oh, well, it ain't working. You still like a cat on a hot tin roof. What kind of diagnostics are they going to draw? It's a thyroid panel. T3, T4, thyroid stimulating hormone. This is a radioactive iodine uptake test. They'll run this through there and see if it's actually going to uptake the radioactive iodine. These first two meds are very important in just a second. They might give them PTU. And I have to look at this for just a second. I struggle with these words too. Methimazole. What are the last three? They are. What do I need to be careful with those? What history do I want to know?
Asthma.
Do they have an asthma problems? They have cardiac selective, and then they just have general. They don't block everything. There is one complication with this. It doesn't happen a lot, thank God. It is a thyroid storm. Once this starts, it is hard to stop. Extreme tachycardia, extreme hypertension. Their temperatures go above 105. Does anybody know where the brain actually starts to fry? The this is horrible, the kid's in the car, where does it start to brain die?
Isn't it different for adults and kids though?
Probably, honestly. It's like 107, 108, like brain cells start to die. Do brain cells regenerate at all? No. Mm-mm. That's it. You only got a set amount. If you got 50 when you born, you will have 50 when you die, unless you lose a few. Why is Tylenol ineffective? What's causing the problem? What does your thyroid gland regulate? Metabolism. What regulates your your temperature? What gland? Does anybody know? Huh?
Hypothalamus?
Your hypothalamus. Does this got shit to do with your hypothalamus? No, sure don't. This is not a fever. This is your metabolism that has gone stupid crazy, and it's amped your body temperature up. This does not have anything to do with your hypothalamus. This is your thyroid gland. You have to cool them off. Now, you're not going to throw them in an ice bath, because then they're going to start to shiver. What drug, and you'll give this IV. It was the first drug on the last page, PTU. Why do you think it happens? Why that first one? You said we're going to go in and take it out, right? If it's causing a problem. Why do you think that might happen? If the thyroid gland secretes it, but I'm taking it out, why do you think it did that? Why do you think thyroidectomy is a cause of a thyroid storm? What are you doing? You going in there and yeah, you taking it out, but you're going in there and cutting on it and messing around with it. And so sometimes, a lot of times, they will preemptively, what do you think, give them? PTU. Infection. If they already are on meds for hypothyroidism, and say, I ain't taking these meds no more, I don't need them. Okay. If they're having radioactive iodine therapy to kill it, it's kind of the same thing as going in and getting surgery for it. It might dump all those hormones in the system. It's like anything. If you go in there and poking a bear, you might get bit. So if the other one's high and hot, what you think this one is? Low and slow. But you are going to be cold. Your metabolism is what? In the toilet. Hashimoto's. Low iodine intake. Lithium. Or if you've taken your thyroid gland out. What's your heart rate going to be? Blood pressure, respiratory rate. Low. Low temperature, low energy. We had diarrhea before, now what is it? Constipation. Hair loss is a big one. So we were irritable before, now what are we? Depressed. Are people that are really depressed feel like having sexy time? Nope. Dry skin turgor. Menstruation will be slow or absent. Now, what is the ultimate slow heart rate? Stopped. So, thyroid storm. Does anybody know the emergency for the slow? If you go into a what? If you don't have enough, they're going to have to give you Synthroid. Levothyroxine is the generic name for Synthroid. The same lab test. You're definitely going to have to monitor vital signs. The complication that is emergent, myxedema coma, it's not just their heart rate. Heart rate, blood pressure, respiratory rate. Can hypothermia kill you? Yes. Respiratory arrest, shortness of breath. If this person came in and you knew they had thyroid problems and they were bradycardic and their temperature was low, what would you go ahead and get and put in the room? Huh?
Bear hugger?
Bring the bear hugger, what else? I might get it hotter in the room. What'd you say? If y'all don't start speaking up, I'm gonna start thumping you in the no-no square. Usually, where is that intubation box? It is on top of the crash cart. If their heart rate's 30, you better bring it in there. If their heart rate's 30 and they're going into a coma, what you gonna do? What? Yeah, you're gonna bag them. Airway, breathing, circulation. You took care of airway and breathing. What's the circulation or cardiac gonna be with a heart rate of 30 and they're in a coma? You can't get an IV. You can't get an IO. What's electrical therapy?
Pacing?
I need to pick up the pace. Y'all do not forget that. If you can get an IV, yes, atropine. And yes, the bear hugger. You can't let their temperature bottom out. Do y'all need a break real quick? You sure? We said the parathyroid gland controls what?
Calcium.
Calcium. What does calcium take care of in the body? Bones.
Heart?
It does have a lot to do with the heart. What meds do we give?
Calcium channel blockers?
Calcium channel blockers. How does it do that? We're gonna go back to some high school anatomy and physiology. How does it work? Because this is why you see these signs and symptoms. How does it work? Why does it make brittle bones if you got too much? It releases that hormone, and what effect does it have on the bones? It goes out and does what? How? What chemical?
You know, like the calcitonin?
Osteo. Yes. Osteoclast. Go out. Guys, this is important. This is what tells you why it makes brittle bones. If you have brittle bones, you have fractures. Where do the parathyroid glands sit? On the back of the...
Thyroid?
Yes. On the back of the thyroid gland. Anybody ever been in a hospital where their family, when they had their thyroid gland taken out?
Yes.
Who said yes? Did they give her any instructions or him?
No, she was kind of clueless. Heard she had a bad experience, so apparently, I don't know. I wasn't really that much.
So,
She was more concerned about the scar on her neck.
I get that. But that's from a triple level fusion. That ain't got nothing to do with that. So, osteoclasts go out and actually remove what from the bones? Calcium. So now I can have what? Fractures. If I don't have enough, parathyroid hormone, I'm sorry. If I don't have enough, then I've got low calcium. If you take your thyroid out, I don't know why I always thought they were huge. They are no bigger than like the end of your little finger, and there's 4 of them. They sit on the very back. I don't think they're attached, but they sit on the back of the thyroid gland, and there's a really good chance if you take that out, you will either take them out or really disrupt them. There are autoimmune disorders. Calcium and phosphorus have a what relationship? Seesaw, inverse. Calcium's low, what's high? And exactly the opposite. If your calcium is low, what kind of signs and symptoms do you see? And NCLEX loves questions like this. I'm not talking about the hyperphosphatemia. What is Trousseau's and Schwastek? You're doing it. Which one is that? If I'm tapping on my cheek, is Schwastek. I think I'm 100% sure. What does low calcium cause? Muscle cramps and irritability. What's tetany?
Sustained contraction.
It is sustained contraction. What is the ultimate sustained muscle contraction? You right. You right. What's what's below tetany? Up there. Seizures. What is status epilepticus? A seizure that won't stop. What are your lungs? Smooth? Do they contract? Do you breathe when you seize? You do not. If you go into status, you can die if we can't break the seizure. So sustained tetany, what can happen to your lungs? You can die, go into respiratory arrest. Now, what is Trousseau? This is going to be on your test because it's on. Every student I've ever talked to had one of these on their NCLEX. What is it? Blood pressure. It causes what? Carpal spasms. What about that last one? Tingling, burning, and twitching where? So your friend who had the surgery, they should have, even if they take a nodule out, they should have said, at any period that you're here, even if you remain overnight, if you start feeling a burning, tingling, or twitching peri-orbital, you need to call me. When they come back in, what are they going to have in their little cup? Calcium. What has happened? They have either taken out one of the parathyroid glands or they have disrupted it. They ain't seasoned. If they were seasoned, they'd probably give them what? IV calcium. What kind of shot do y'all get? Tetanus. Why? How do you get tetany? You cut yourself on, and it comes from what? What's in that rusty metal? It's a bacteria, and it secretes that toxin. How does it kill you? Tetany, respiratory and cardiac arrest. It's a different reason you get it, the same outcome. Muscle aches and cramps, tetany, seizures. What is the safety with this besides do CPR? The seizures. What kind of precautions? Seizure precautions, which are what? Patting the bed rails. If they do have a seizure and they come out of it, turn them on their side. Have the suction. You should have. What two things do you need to have in your room every time? Suction. You can do without oxygen for a second. And move back. If I got those two things, I can rule the world. I'll be screaming for some oxygen, but I got 21%. You need to start bagging them with that and start yelling for some oxygen. Because everybody can do CPR. They actually have a pad that you can put on the floor. You need to turn what down? The lights. If your family members is in there talking about the Wheel of Fortune and yelling at each other, tell them to get out. They need to be on the monitor. High calcium diet. Full set of vital signs. Cardiac monitoring. Why are we doing an EKG? Because their cardiac can be irritable. What kind of blood test? Does calcium come in a CMP? Calcium and phosphorus? How many say yes? How many say no? It's a different test. You have to order calcium and phosphorus separate. Why? Has anybody ever seen, so they come in with cardiac problems and they don't really know what's causing it. What kind of drip do they hang? It's not calcium. Why do they do that? It stabilizes something. Magnesium. And she's right. Maybe 1 or 2 grams. The cardiac membrane. It's not because their magnesium's low. Their calcium may be. It doesn't have the same effect as phosphorus. It doesn't affect the calcium. But it'll help stabilize that membrane until we can figure out what's going on. If their calcium is low, we have to give them some. I cannot remember. I think this might be on your test. So, not the first part. If we're giving blood transfusion, packed red blood cells, why at some point might I give them calcium?
Citrate.
What does a calcium citrate have to do with this? Why is that in blood products?
Citrate like prevent the blood from kind of coagulating in the bag.
It's a preservative, right? What is calcium citrate? Why does that mess with anything?
Binds to the calcium in the blood.
It binds to the calcium. After about 4 units, do you know what's going to happen to your QRS? It's going to start widening on out. What's the ultimate wide? Flat line. Once you start seeing that get wider and wider, you better do something. It's called a sine, S-I-N-E, wave. Now, we used to have the protocol that basically when we're hanging blood, not in the line of the normal saline with the blood, because we'd always have a different line, we would put calcium gluconate in the saline. Because if you don't give them calcium and you're giving them 4, 5, 6 units of blood, it's going to happen. If it's not that bad, calcium gluconate. If you give them too much calcium, can you get the opposite effect? We don't want to do that. Calcium gluconate. What's the other form of calcium that's in the code card? Calcium chloride. It has 3 to 4 times the amount of calcium in it. Aggressive problems call for aggressive. If it ain't that aggressive, don't get that aggressive. That's not that aggressive. If it's just a little bit wide, we're going to give them calcium gluconate. Guys, if it's bad, absolutely. If they go into cardiac arrest and they've had this problem, guess which calcium they're going to get? It ain't that one. They're going to get calcium chloride. If you get there and their QRS is, oh my God, wide, I'm not going to this one. I'm going to calcium chloride. Now, we just said if it's too low, but now what? It's too high. Too much. You got high calcium. What's your phosphorus? Low. You might have a tumor. It might be malignant. It might not. Why do I keep talking about vitamin D? Do you absorb calcium without vitamin D? No. How do we get vitamin D? Sunshine. Or right now, you can't go sit out in the sun. It's too hot. If you have GI issues, you're not going to have the right absorption of calcium. Renal failure. So what causes the signs and symptoms? Because your calcium's too high. They say bones, stones, groans, and moans. Why do your bones hurt? What we just talked about. They're either brittle or you have had a fracture. What are kidney stones made out of? If anybody's ever had one, they might tell you to stop drinking milk, Coca-Cola, or even sweet tea is a lot of times the cause here down south. GI symptoms, they are going to frow up. Constipation, indigestion. What is a psychiatric moans? It has an effect on the nervous system like psychosis. It ain't just irritable. If it's too high, what are we going to do? We got to lower it. You ain't going to give them a calcium-rich diet if it's too high. What is that med? Do y'all know what gland secretes that? The thyroid gland does. What labs? I wanna know the calcium level. We're gonna do a CMP. I gotta get that calcium level down. What if it is a nodule or a cancerous region? What are we gonna do? Now, what might we cause a problem with? Where did I tell you they are? They're on the back of the thyroid gland. What are you listening to probably do? You're gonna piss the thyroid off, or you're gonna have to take both out. So you have to be careful when you're going into that. Why don't y'all take a quick break, cause y'all fading fast. Do y'all have clinical